Thank you everyone for joining us. Let me start by saying this session is being recorded and it will be posted to our website. And then I just want to welcome everyone and let you know that we're very glad that you're joining us today for this conversation about the really catastrophic situation in Sudan that nobody really talks about hardly enough. So we're hoping that today we can shed some light on the urgency of the situation and sort of mobilize some some action. So the webinar today is brought to you by the Humanitarian Relief and Recovery Task Force, which was established earlier this year, and for which the Arab Foundations Forum, us, is the secretariat. The purpose of this group is to support coordination and collaboration between Arab foundations and nonprofits operating in crisis and fragile contexts. And we work to advance localization and empowerment of local communities by identifying their capacity and funding needs and supporting matchmaking efforts. So today, the task force is very proud to leverage the sometimes extensive experience of some of its members and their networks, and as well as our very esteemed guest panelists here today. So I want to thank you all, our esteemed panelists, for being here today, and also for being everyday heroes who actually work tirelessly to support your fellow Sudanese citizens. I know this is a very difficult time for some of you, for all of you. It's been a very long year, a year and a half, I think, or more. And I know that I'm sort of, we are taking you away from a very busy time, I'm sure, but so we're very grateful for your presence. So let me start by introducing each one of our panelists very briefly. And I can't be too brief because their bios are just so accomplished. So I don't want to skim over this. So I'm going to start by introducing each panelist, after which I will introduce our moderator and I'll hand the floor to him. And then let me just say that while we're talking, I will post in the chat all the relevant donation links for each of the organizations that are here with us today. If you are so inclined to help out, please click on those donation links. And also, any questions that you have, if you could please post those in the Q&A at the bottom of your screen, that helps us to kind of keep track of the questions. And then at the end, we'll just have a brief wrap up. And if anybody has any further questions after the seminar, please feel free to write us over at AFF. We're happy to connect you with anyone that was here today or answer any questions. So first, we have Ms. Fadwa Shawgi. Welcome, Ms. Fadwa. Fadwa is a proactive leader with 18 years of diverse experience in the commercial field, oil and gas telecommunications as well, and is currently serving as the general manager at the Sadaqat charity organization, a prominent NGO in Sudan. Fadwa is deeply committed to community service with a passion that extends from local to regional levels and with a strong dedication to uplifting the African continent. Thank you, Fadwa, for being with us.
Thank you so much.
Next, we have Dr. Mohammed Al-Mahal from the Sudanese American Medical Association, SAMA for short, where he is the executive director and where he plays a key role in strategic planning, fundraising, and marketing to support their initiatives. Dr. Mahal has developed and led campaigns that fund humanitarian efforts in Sudan, including feeding programs for displaced populations and medical missions to deliver essential supplies. Under his guidance, SAMA has also expanded virtual education programs for healthcare providers, supporting skill development in Sudan and in South Sudan. Thank you for being with us, Dr. Mohammed.
Thank you, Nihal.
Next, we have Dr. Pauline Kamau from the American Friends Service Committee in Nairobi, Kenya, also an AFF member, where she is a research policy and advocacy director. Dr. Pauline contributes to research and advocacy work in Africa in peace building, conflict resolution, just migration, gender, and youth inclusion. Her role involves civil society capacity building and advocacy, research and policy briefs development for advocacy, convening, quiet diplomacy, and dialogues at different spaces in Africa. She has contributed to several publications and policy development on sexual and gender-based violence, women and children's rights. Excuse me. Pauline is a trained mediator in dispute resolution and conflict management and has over 25 years of experience in development work across Africa, especially East and the Horn of Africa. Welcome, Pauline. And I know that we are all very nervous about our internet connections today. So for those of you who are here, there's 3 of us that are in Cairo and our internet is spotty, and as Pauline. So we're praying that we get through this without any more bumps. But thank you, Pauline, for being with us. Our next panelist is Ronald Veilleux. I hope I'm saying that right, Ronald, from the International Medical Corps, also an AFF member, who has actually stepped in at the last minute to replace Dr. Bernadita Gaspar, who was slated to join us today. And unfortunately, Dr. Bernadita contracted typhoid, I understand. So she is out sick. And so this is sort of, unfortunate, but it also demonstrates the situation of, what aid workers are dealing with when they're in working in those in these contexts. For the International Medical Corps in Sudan, he has over 20 years experience in humanitarian operations, and Ron has proven skills in strategic planning and management, program quality and development, key partner and donor relations, fundraising and budget management, emergency response, security, and operations management. Ron is a manager who has worked in complex emergencies such as the Democratic Republic of Congo, Uganda, South Sudan, Chad, and Bosnia-Herzegovina. Thank you, Ron, for being with us today at the last minute.
Yeah, good afternoon and greetings from Port Sudan.
Greetings. And last but not least, we have Dr. Sarah Ibrahim Abdel Galil. Sarah is a Sudanese UK-based doctor and democracy advocate, active in Sudanese diaspora initiatives, and a dedicated member of Sudan's Doctors for Human Rights with a focus on child protection. Dr. Sarah is also an expert in emergency humanitarian assistance, aiming to leverage her experience to create a positive global impact on vulnerable populations, especially children. Recognized as a diaspora engagement expert by the European Union Diaspora Forum, Dr. Sarah also consults for Shabaka, a social enterprise focused on diaspora-driven humanitarian aid, where she contributes to mapping the Sudanese diaspora for humanitarian support and establishing a crisis coordination unit. Additionally, as a co-founder of the NGO Governance Programming Overseas in Sudan, she educates youth on governance, democracy, and human rights principles. Thank you, Dr. Sarah, for
Thank you
taking
very
time.
much for the invitation.
Thank you, Dr. Sarah. So again, thank you to all our panelists. And now let me introduce our very esteemed moderator, Mr. Ahmed El-Jaili, who is a partner at an international law firm. He received a Juris Doctorate cum laude from Harvard Law School in 2003 and a Bachelor of Arts magna cum laude in Economic Development Studies from Harvard College in 1998. He was the first ever Sudanese graduate of Harvard College. Ahmed previously served as the president of the Harvard Arab Alumni Association and on its executive board. Ahmed has written extensively on constitutional issues in Sudan, including his published essay on federalism and the tyranny of religious majorities in Sudan, which was actually assigned for several years as required reading at the Kennedy School of Government. He provided extensive alternative drafting and commentary on the 2019 constitutional document, and he also submitted a request to the ICC to investigate the June 2019 massacre. He provided several pro bono services to the transitional government, including in connection with the preparation for the Paris Donor Conference in 2021. He was deeply involved with various Sudanese advocacy groups and initiatives, including being a member of the steering committee for the Revolutionary Forces Unification Mechanism. That's quite a mouthful. Thank you so much, Ahmed, for being with us today. And I actually turn the floor over to you. Oops. Do we have?
And thank you, AFF, for hosting us. Can you hear me?
We can hear you. Your picture is frozen, though. I don't know if that's on my end.
Can you hear me?
Yes, yes. All good now.
Okay, good. Well, I'll repeat my thanks to you and to AFF for hosting us and for shedding the light on what's happening in Sudan. And I extend the thanks, obviously, to the very esteemed panelists. As a moderator, I'm not supposed to talk a lot, but I will take a minute to state, if you will.
Oops, we've lost Ahmed. I am so sorry, everyone. We are all having terrible internet problems today. But here you are again, Ahmed. Sorry, we lost you for a second. Are you back?
Did you
Yes.
lose me, or what happened?
Yes, we lost you for a second.
Okay. Apologies. I'm not supposed to be having internet problems. I'm not in Cairo, but I apologize about that. No, I was saying I'll just spend a couple of minutes with a brief background. Obviously, the panelists are keenly aware of what's happening in Sudan, but just to set a level playing field for some of your audiences who may not follow exactly what's happening in Sudan, I want to briefly talk about how did we get there, and importantly, where we are today, before turning to the more interesting part, which is the contributions of our esteemed panel. I think in less than a minute in terms of the history of Sudan, and it's very difficult to ask a Sudanese, let alone a lawyer, to speak briefly about political history of Sudan. But for those who are not aware, Sudan has been caught in this vicious cycle of coups and wars and democratic rule that is disrupted by military coups, all the way up to 2019, when the 30-year reign of Omar al-Bashir was ended by a popular revolution that brought a lot of hope and really united all Sudanese in a desire, a really keen desire for a better future. And there was really an incredible euphoria that wasn't felt for decades in Sudan. Unfortunately, it was short-lived, and in 2021, the military and the RSF militias staged a coup to abort the democratic experiment. And then in April of last year, they turned against each other and they started a war that is still ongoing. This doesn't do justice for why the war started, why and who is backing whom, and the geopolitical aspects of the war. That's not the subject of today's discussion. I think the subject of today's discussion is the abhorrent scale of human suffering. And it is shocking to me when I talk to friends and colleagues who are not from Sudan, when I share just snippets of what's happening, and they have no clue. And that's why it is fair to call what's happening in Sudan not just the forgotten war, but it's really the forgotten human tragedy. And because if you look at the menu of human suffering, it's all there. There's incredible numbers of dead, injured, incredible and very troubling cases of rape, a rising risk of famine. The displacement and refugee figures are just staggering before we even get into the level of economic loss. And just to just give a few numbers on each before we start the discussion, so people can contextualize the very difficult circumstances that these extremely remarkable panelists are working through. Conservative numbers of the death in Sudan have hovered around the 20,000 number for the last couple of years, which is very interesting when a war is ongoing and the number of deaths is still fixed because people don't have data. A few weeks ago, there was a recent study by the London School of Hygiene and Tropical Medicine that focused on the deaths in Khartoum state alone, and their number was triple that. that over 61,000 people died in Khartoum, of which 26,000 was due to the violence, and the rest was disease and starvation. And if you project that to the rest of the country, where there's been even more horrific levels of violence, the numbers start becoming quite scary. And it's not just the violence, but it's disease and famine, which has been reported in a number of refugee camps, especially in Darfur and elsewhere. And the World Food Program is calling Sudan the largest hunger crisis in the entire world. And with all the crises and hunger and feeding issues we're having in Gaza and elsewhere, Sudan is actually the largest hunger crisis, with over half of the population suffering from insufficient food, ranging all the way to full-fledged famine. Part of that is the disruption and displacement that happened to people. The fact that the war actually erupted in the capital, and you had an incredible influx of people out of Sudan. There's a staggering number of over 11.5 to 12 million people who are displaced in Sudan, but 8 of them internally, and these are conservative numbers, and 4 million that have crossed the border to Egypt, Ethiopia, Chad, etc. And in these circumstances where people are really just literally leaving with the clothes that they were wearing, and not being able to provide for themselves, this is where disease, hunger, etc. onsets if they're lucky to be not to escape the violence. Economically, lastly, we have nearly half the population is unemployed because the economic activities have all but stopped in large portions of the country, as well as all the support services, education, health, etc. A recent November situation report by OCHA is indicating that acute malnutrition remains above famine threshold in a number of camps, including the Zamzam camp in Darfur. Cholera is still an issue, and I haven't even begun to quantify the increasing and alarming increase in reports of sexual violence and rape. So it's a very grim picture. And that's why it's important to understand the scale of the disaster that had befallen the people of Sudan, and the literal trauma that 45 million people are living. But also, I think it's important to offset that by the good work that we're hopefully going to hear about, the essential good work that these guys are doing for the people of Sudan. So I'll pause there with that introduction, and then I'll start with our panelists, ask them to each to just give a brief 5 to 8 minute introduction about their organization and the current role they're doing in Sudan before we delve into a Q&A after that. Ladies first, I'll start with Dr. Sada.
Thank you very much, Ahmed, and thank you for putting the first steps to clarify a very complex background in Sudan. And let me agree with you on all of the points, but stress on an important aspect, that the war in Sudan at the moment is not a civil war, because this is something that is incorrect. It is a war against civilians. The Sudanese civilians chose peace to build a democratic state. And this is very important and essential. And I think at this level, we don't want to be number one, but sadly, we are number one in the statistics in regard to the internally displaced population worldwide, to the degree of malnutrition, acute malnutrition among children. And we know that the figures about the famine is not all available. My work as a Sudanese diaspora based in the UK, half of my life, is ongoing for years and years, because sadly, Sudan is a fragile state with the ongoing dictatorship and lack of governance. And it was mainly when there are outbreaks of cholera, dengue fever, the floods, So we have built this network transnationally among the diaspora. Unfortunately, the diaspora groups are not well recognized, despite of their contribution to the humanitarian crisis. And let me concentrate on this crisis. Basically, the international humanitarian response was poor, was paralyzed, and the Sudanese mutual aid groups inside Sudan, with very few organizations that you can hear from examples today, together with the Sudanese diaspora, stepped in to save lives. And the stepping in is not only about providing money and remittances. So an example from Shabaka, which is a diaspora-led organization based in the UK, is to augment the diaspora response during crises. And in this case, it was for Sudan, but it works globally. There was what is called the Sudan program. And in this Sudan program, we started by thinking, first of all, as being a doctor in the National Health Services, that we want to be deployed. We want to go and save lives. And this has happened in Turkey, in Afghanistan, in Syria, in Turkey, in Ukraine. However, the deployment was not supported. So we thought, how can we do? What can we do? And we built the coordination unit, which worked for 6 months. It stopped because the donation stopped after 6 months. This unit was recognized nationally and by the Royal, as well His Majesty King Charles, for the work that we have done for 6 months. Basically, what we have done is localization in action, and what we have done can be done by everybody. So this is what we are reaching out to the international community. If we could do it, you could do it. What we have basically tried to establish is mapping the real actors on the ground. We did that immediately after the eruption of the war. What are the needs? What are the complications? And in different states, because each state in Sudan, we have a diverse community, is different from the other states. And this mapping allowed us to identify the real actors, not only emergency response groups, but as well other mutual aid groups, as well about the possibility of serving the internally displaced population. We're all aware of the issues with Khartoum, with Darfur, and now with the Jazeera, and that access can be a challenge. But because we have the internally displaced population, the 10 million, are either with their relatives or inside schools or in other shelters, they are not seen as like displaced population in camps, and therefore they are invisible. The second part, we facilitated cash transfer from different organizations internationally to work with mutual aid group. And that was at the beginning of the war, when the international community was very hesitant to do that work. Together with the mutual aid groups, we identified areas that they wanted to be trained on. So it's not we are imposing training, but they have identified areas of governance and humanitarian aid, humanitarian principles, conflict sensitivities, and others. And this training was done in a blended way, on the ground and virtually, and was led by the mutual aid group themselves in Sudan in different areas. We have created a platform for information sharing. We called it Inform and Connect. We invited other organizations because without sharing the data, then we will not be able to work together effectively in such difficult time. And we noticed that despite there's a lot of mapping going on, a lot of information gathering, but the information sharing among different international and national organizations is not that great. And holding on the information will not help. So we tried to lead by example by forming this Inform and Connect, give the information that we have, and try to help on building that. The coordination unit was led by Sudanese. The researchers on Sudan were Sudanese. There are non-Sudanese friends who helped, but basically we have done the work to say that you can reach the ground, you can work with those on the ground, and you can save lives. At that time, the work by the international community was very limited. And last minute, I would like to discuss about what we have done after that. As medical diaspora, we continue to support medical education during conflict in a very successful program by simulation-based education. By the end of this year, 1,000 medical students would have completed their emergency training, which is accredited, and more than 200 facilitators would have been trained. As well, we have established telemedicine services with Meta to serve population in Sudan and those who are refugees, because refugees in neighboring countries are suffering in education, in health, in shelter, in protection, and there is a lot of work to be done. I'll stop here and happy to share further examples later on. Thank you.
Thank you, Dr. Sarah. That's extremely impressive and informative. And we'll come back to you with a few questions in the Q&A. Next, I'd love to hear from Dr. Pauline about the work she's doing and her organization.
Sorry, thank you so much, moderator. I'll ask you to allow me to switch off my camera after this because of the bandwidth. I'm in Bujumbura,
Sure.
and the network is not good at all.
Understood.
So I'm Pauline Kamau, and I work with American Friends Service Committee, which is a Quaker-based organization. And this organization is devoted to peace, and we have got peace programs throughout the world. And it is based on our belief that there is worth of every person, and we can use faith to overcome all kinds of violence and injustice. We were founded in 1917, and we won the Nobel Peace Prize together with the British Friends Council, representing all the Quakers in the world because of refusing to go to war. In our organization, we work in the US. We are based in Philadelphia. And also we have international programs. Some of them are in Africa, Asia, Middle East, and Latin America. I want to focus mostly in Africa, where we work in countries like Burundi and the Horn of Africa, where the Sudan comes in. And our work also is based in Sudan and the 8 countries, which is Djibouti, Eritrea, Ethiopia, Kenya, Somalia, South Sudan, Uganda, and finally Zimbabwe. But we are able to reach other countries, using what we call a dialogue and exchange program, so that we can be able to, to lift up the voices and also sustain transformative shifts in systems of power in all countries. And now as I said, we work in just peace and also just migration, because we want to see humane treatment of all migrants, be they refugees, be they also internally displaced person, and we also want to see peace. So we do a lot of advocacy and trying to bridge and convening so that we can bring out the voices of the people on the ground. And of course, we work on community strengthening. I also want to say that we have actually some of the civil societies we work with. I invited them to come and listen. Some of them are based in Sudan. Some of them are even all the way in my country, Kenya, and that is where they are. I come back now to Sudan, the forgotten war. Why is it forgotten war? And a moderator even put another aspect of that. And I see it is forgotten because we don't hear about it. Look at any news media across the world. You hardly hear about Sudan. And why is it forgotten? Whose interest is it in Sudan? Who is supplying arms and fueling conflict in Sudan? As Dr. Sarah said, that this is a war against civilians, and we want to see this war stopped. And of course, we want to see aid start flowing in Sudan. And of course, I want to go back and ask myself why. Sudan is the world's largest displacement crisis. And Dr. Sarah and the moderator put the numbers to us. And I want also to bring in another angle. If I look at the children who are out of school. 19 million children are out of school in Sudan. Imagine, this is actually the whole population, losing a whole generation of people without education. Then I come to the issue of, if I look also at the gender-based violence, about 6.9 million women and girls are at risk of gender-based violence. And these are old statistics from OCHA. So it is actually happening and happening. And of course, I read another article from Dr. Hira, and it was saying that 90% of GBV is actually through gang rape. And of course, women are trafficked, sexual slavery, and also they are forced, they are forced to work. And I also want to mention just one story of a girl who was 13-year-old girl who was gang raped by RSF soldiers. They are young, they have been recruited young, and she was raped in front of her family. And they also threatened to expose her to the social media unless they are bribed or they are paid. The family had to pay. Imagine the trauma of that young girl who has been raped, and then she is being exposed to social media. And of course, we have had cases of mental health. Survivors do not get treatment because of the health system has broken down, as Dr. Sarah has also talked about. In fact, you see that the rape cases, some of them commit even suicide. They jump into the Nile because it is a taboo to be raped and then you get a child out of rape. So we have seen this happening in Sudan. And of course, I also want to say that even in the water points, especially the refugees who are going to Chad and the ones who are in Ethiopia, I want to talk about the ones in Ethiopia because we have worked with them. And the water points where they go to pick water, it's far. And they face violence from militia. You are in a different country and you face violence from militia, and a number of women and girls have been raped. So there is no place which is safe for the Sudanese, not their country, not even where they go to. So you can see the scenario there. So what have we been able to do as American Friends Service Committee? And we also tried to do advocacy work. But when we saw the suffering, especially for the people of Sudan who are coming to Ethiopia, where we have an office based in Addis Ababa, we had to do a rapid appeal. Remember, they were coming without any clothes. And imagine women, reproductive health. They didn't even have the dignity kits. So it is just to start giving them that. Food is in short supply. So we were able to. The numbers are overwhelming. The world is quiet. Not even those in Sudan and those outside Sudan are getting mute about Sudanese. So even medicine is in short supply, both in and out of Sudan. And what else have we been able to do? We have been trying to raise the voices of the Sudanese people in different places across Africa and even across the world. Early this year, we held demonstrations. Enough is enough. We want to see action, for people in Sudan. And also we have written to White House about the situation in Sudan because we are not able, we want to see action being done. Remember, AFSC is an advocacy kind of organization, and we try to reach, the voices, and we try to change systems. Why is the world so quiet when Sudanese are suffering? We collected about 11,000 signatures, and we went to the White House calling to an end to the war in Sudan. We've also been able to advocate a hearing in Sudan, in Capitol Hill, and urged even senators to write a resolution about Sudan. Now that the regime is changing, I'm not even sure what is going to happen. And we have also gone to the UN General Assembly and spoke on gender-based violence and convinced the rapporteur to visit Chad and see the Sudanese refugees there. And apart from that, our advocacy work is trying to reach different spaces in Africa Union, asking them, these are our brothers and sisters. Why are we quiet when they are being violated? And some of the things of the pressing needs that we are seeing, especially as we interact with Sudanese, both in and out of Sudan, is that they need support. They need food. The internally displaced people need food. The food which is being taken, especially by WHO, if it's given to the Sudanese armed forces, they give it to the soldiers. It doesn't reach the people. And of course, we need to also keep on talking about, can there be ceasefire? We need humanitarian support to reach the needy. Medicines, food, dignity kits. And of course, we need to continuously raise the voice of people in Sudan in every space that we go to. Please, I call upon everybody. We need to keep Sudan at the top of the agenda. Use whatever means you can, media, social media, print media. Speak about Sudan. Speak out on those who are fueling the war in Sudan and what their interests are. We need to say that these are your interests and you need to stop fueling war in Sudan, because the civilians are using rape as a weapon of war. We have seen it being used all over the world. And we want the special rapporteur to bring these violators to book. And we want to see justice done for the women who have continuously been violated in Sudan. And
thank you, Pauline.
today, okay, thank you so much.
Thank you. I know. Look, I really admire your passion, and I think you speak for all of us because of the frustrations and the real pain that we feel for what's happening. And I'll come back to you with a couple of follow-up questions. I'd love to now just give the mic to Fedwa to talk a little bit about the work that Sadaqat is doing.
Hi, everyone. Thank you for the opportunity. Thank you for the Arab Foundation for the opportunity for shedding light on what's happening in Sudan. Thank you, Pauline, for being so into our case in Sudan. We are so grateful for your efforts, for being that enthusiasm with what's happening in Sudan. So I am Fedwa. I am the general manager for Sadaqat Charity Organization, which is Sudanese national NGO.
You're muted, Fedwa.
Yeah, I thought it was just me, but we can't. Can you go back 30 seconds?
Yeah. It has been like a year. Thank you. Okay, thank you, everyone. Thank you for the Arab Foundation for the opportunity. Thank you, Pauline. Thank you from our hearts. I am Fedwa Shawki. I am the general manager for Sadaqat Charity Organization, which is a national Sudanese NGO, active in Sudan since 2002 and registered in the Humanitarian Affairs Commission since 2012, with strategic partners in what we call it sister organizations, Sadaqat USA, Sadaqat UK, and Sadaqat Canada. We have been active in 4 sectors in the last more than 20 years in health, education, wash, feeding, and lately with after the conflict in protection and in sheltering. We didn't want to be that expanding, but this is what's happening in Sudan since the COVID, and before the COVID, the floods in 2019, and then 2020. We have expanded in other activities to support the IDPs. The IDP number started to increase since that time. Then the conflict came. So after the conflicts, one of our major sectors now is the feeding, because people in the hotspots are people even in the IDP camps, people in the who are IDP in safe towns. They are really suffering to find food, because as we said that more than 50% of the population in Sudan lost of their source of income, so they cannot feed their families. So the Sudanese community has been always just like standing with each other. What we call it takaful in Sudan, which is one of our main strengths that we believe that we are still keeping it, although it's very difficult now. So central kitchens had came up as an idea that served those communities. It started with initiatives from the local communities, and then gradually it increased. Later, international organization came in, WFP, UNDP, and other organizations came in. But Sadaqat has been active in and running more than 60 central kitchen scattered between Khartoum, Al Jazeera, Kassala, Darfur, South Kordofan, and North Kordofan. It served almost like more than 100,000 population in those areas. We are facing big challenges in running those kitchens due to the difficulty of the communication, the collapse of the infrastructure for telecommunication, the collapse of the banking system after the war, and many other challenges. And let me here just highlight that one of the issues that we are facing there is that we are working in a very complicated context that it does not always match with the requirements and the criteria of those international organizations. So we have been talking about this in the last few months with the international organizations, that there are some amendments and adjustments that need to be on the way of working to match the context that we are working on in Sudan. Sudanese were the first responders to the crisis, internally and externally. The diaspora played a role that really very big. Sadaqat USA and Sadaqat USA were the first responders. Sadaqat Canada and Sadaqat UK, who are initially individuals, the Sudanese individuals living there, and then other organizations in there. So there are also the health interventions, the IDP camps. We have been working in running the dialysis centers in those areas. We have established cardiology centers, ICUs, HDUs in the northern states. Also in the WASH activities, we're working, one of our main programs is the water yards, which run by and powered by solar systems in villages that had been occupied by very big number of IDPs. So there being very high pressure on the source of water. The clean water become not enough for the communities, the host communities, and the IDPs. So we had to intervene on providing the water supply, the clean water supply. After the war, we did like 20 water yard projects run by the solar system. Unfortunately, part of them now in Al Jazeera, and we know nothing about them, but we are still working, and we are still adding more in the northern and eastern states, which are now had a larger number of IDPs. one of our also biggest project that we are targeting the children in Sudan who are now almost most of the schools are not working. Children had been out of school for 2 years, more than almost they say it's around 30 million for the last year, and this year the number of children accumulated that they didn't go to school. So we have the e-learning education in partnership with UNICEF. It's targeting the children who are out of school, dropouts from school in 9 states. 9 states. One of them is North Darfur, Sinnar, Al Jazeera, and other states. The program is really helpful for the children, and it keeps them from dropping out of school. But to be honest, the program will not. It does not include being certified or moving to another grade. So still, the children of Sudan will be like out of school because this does not qualify them to go to university or to high school or whatever. It will just make them they can read, they can write, they have the basics of math and whatever, but it will not allow them to go a step after step. So this is also a shout out that children of Sudan will be like, the education cannot wait for the war to end. We need to add, so we need to do something because this will make a huge difference in the future of Sudan. After 2 years, there will be no kids with the higher education, even the higher education, or graduated from the secondary education. So this is very important. We need the effort of the international community to help on this. I don't want to add more. I don't want to take more than that.
Thank you, Fadwa. I know the need is infinite, and there's so many good areas where Sadaqat is working. I'm personally aware of the good work you're doing, but let us come back to you, and let me invite Dr. Mohammed to talk a little bit about SAMA and the work they're doing.
Hi, everyone. Can you hear me?
Yes.
Okay. So thank you very much for AFF for inviting me today to this webinar, important webinar. And also, I'd like to welcome everyone and the participants who are interested in hearing about Sudan today. So I want to reinforce that Sudan is really grappling with one of the most devastating crises in the modern history. And I wanted to shed light more here on the effect on the health system that happened in Sudan. So after the war, Sudan health system has really nearly totally collapsed, and that's mainly it's reported that 60 to 70% of the healthcare facilities in Sudan have been non-operational, non-functional due to the repeated attacks on the hospitals, on the healthcare facilities, and also the repeated attacks on the healthcare workers. And that's really, in Sudan, it's really challenging to receive medical care, especially for a special patient population, including cancer patients and chronic kidney disease patients. They've really been frustrated. Another thing is the food insecurity, where all of the agricultural activities have been disrupted. The roads and the storage sites have been disrupted, which led to skyrocketing prices and hunger widespread in the Sudan. So SAMA, Sudanese American Medical Association, it's a U.S.-based organization that also has its office in Sudan. Now it's located in Port Sudan, and its main role is linking between the global Sudanese diaspora and the urgent needs in the conflict, urgent needs affected by the conflict in Sudan. And so we've contributed much in this after the war, and being Sudanese professionals, it positioned us uniquely to respond mainly through partnering with local organizations and local community, and this is what is referred as the localization agenda of aid. And so SAM acts mainly as a conduit, mobilizing financial and technical support for the local community organizations so as to deliver their aid, because we believe that those organizations, the local community, are more aware of the situation in Sudan and more, and they can assess, the needs rapidly and also mobilize rapidly so as to respond to those needs. And this is especially helped us, because of the escalating situation in Sudan. Maybe 2 or 3 weeks before the war has expanded to Jazeera state, a state that was very safe before, and massive displacement happened into other areas in Sudan, and so as to be able to respond very effectively to this, using those community or people on the ground was really very helpful so as to be able to respond. We're mainly focusing on feeding, and this year we delivered more than 600,000 meals to maybe 20,000, over 20,000 IDPs located over 4 states in Sudan, including Sinnar, Gadarif, Red Sea for Sudan, and now we're expanding to Halfa and Shendi after the displacement crisis in Jazeera. And this is again mainly through partnering with local organizations. The other thing is the healthcare. We've been doing medical missions, bringing United States certified doctors into Port Sudan and delivering medications and medical supplies to public hospitals there. And this really has also relieved part of the burden that healthcare facilities were facing. Especially in the urban areas, we might think that urban areas would be more or having more capacity, but still the increasing influx of those IDPs into those urban areas, makes really the health facilities there are overburdened and cannot, provide healthcare services. And this is why we've been focusing on Port Sudan public hospitals so as to increase their capacity by delivering medications and medical supplies. This is the second thing. The third thing is the education. We know that this is a really overlooked part of the, especially in crisis where we think like food, healthcare are more important, but still think that education is really a critical part of this, especially when it comes into training the healthcare providers who are the first line responders to the in this situation. And we've been leveraging we've been leveraging especially virtual education so as to train healthcare providers on things like responding to traumatic injuries and also to things like approach to trauma patients using ultrasound techniques, for example, for vascular access, all of the things that are related to the context in this war. And we established a center in Port Sudan, Sama Center, which is really equipped with internet access and solar panel and optimized environment so as to support our educational activities at this critical time to train those healthcare providers and frontline providers. So this is a much of what SAM has been doing. The need is really large, and I think we need to collaborate, all of us, so as to be able to relieve even part of the suffering that our people have been facing now. Thank you very much.
Thank you, Dr. Mohammed, for the remarks as well as for the really important work that that Sama is doing. Last but not least, and in case you wonder what the logic of the order, it was females, then males in alphabetical order of the last name. So there was a logic to the madness. But last but not least, please, Ronald, share with us a brief introduction about what IMC is doing and what they're doing in Sudan. And then if you can limit that to 5-6 minutes, and then would love to get into rapid fire Q&A. Yeah.
Sure, thanks. And thank you to the AFF for this opportunity. The International Medical Corps was founded in 1984, and we've been working in Sudan since 2004. We work in 8 states across the country with over 300 Sudanese staff and a small team of international staff from across the world. We're mainly focused on health programming with primary health care, community-based health with volunteers, and reproductive health. We include in that integrate a nutrition program. As you know, the indicators for famine are very high. The malnutrition is rampant across the country. And in addition to that, we work in water sanitation, mental health, and we work with victims of sexual violence across the country, which will be one of our flagship sectors in the next year. Like my colleagues, and I hope I'll be as eloquent as they are, this is a forgotten crisis. Even internally, I'm having trouble convincing my headquarters that this is as important as Ukraine or Gaza. If you just look at the numbers, the Sudan crisis is Gaza times 10, times 15, but we're not getting that attention. On the other hand, when we talk to different donors like the US government, the European Union, and other private foundations, we see that for next year in 2025, the funding should be going up for Sudan, so that we're getting at least that attention, that the resources are going to be there. But in my experience working here, I'm based in Port Sudan, but I had a chance to travel across the country. In Kassala, for example, where there are close to 500,000 internally displaced people, I mean, we're doing over 100 consultations per day per health worker, wow, which is huge. The IDPs, when you're driving through town, they're just making makeshift shelters on the side of the road in very horrible conditions. I was in Omdurman, just outside of Khartoum a month ago, and you can hear the shelling every night. And with our staff, we're saying, okay, if something happens, what are we going to do? We're going to need to relocate. Over the past year, we had to close 2 field sites, one in Al Jazeera State in Medani, and one in Sinja just recently in Sennar State, where our staff had to leave everything behind and just go, just so that they can save their lives. So the context is very difficult. Not only this ongoing conflict, but the banking system is down, the communication is difficult. So what you do in a normal country program is hard enough, but to having all these different parameters on top of it, make it probably, in my 20-year experience, this is the most complex environment I've ever worked with in. And on top of that, you have the government has very strict guidelines. You have to negotiate through that. You have different armed groups you have to deal with in the field, in the Darfur area mostly, and here in some parts of the eastern parts of Sudan. So it's a continual challenge. And I'm totally impressed by my colleagues from Sudan who have the resilience to continue their work every day in these very tough conditions. Once again, I think that the funding, the resources from different governments, we're going to have an upsurge in 2025, which is very reassuring. But the conflict continues. The peace talks are not bringing a ceasefire or any, or even opening a humanitarian corridor so we can get supplies to the hard-to-reach areas. So those are the things that we're going to in our own advocacy, is to be able to get supplies where they're needed most, because the indicators, the numbers are showing very dire situations in most of the country. I think the last numbers I saw is that people in need is over 25 million people, over 8 million displaced in countries all over the region. And it's not getting any better. It's trending in the wrong direction. So in summary, IMC, we're doing the best with the resources that we have, but we need more access to the hard to reach areas and to the people most in need to do our job. We don't want to get involved too much in the advocacy of the political side. We're just operators who want to help as many people as we can. Thank you for this opportunity, and back to you.
No, thank you so much for the remarks and for being on the ground and for describing what sounds like a perfect storm that has struck Sudan and continues to do so, but with a few glimmers of hope, it seems. So this, I think, concludes the introductory remarks by our panelists. What I want to do for the next 15 minutes is just rapid fire questions. If the panelists can kindly limit the responses to 1 to 2 minutes, so we can get as many of these questions as possible. I'll go back to the beginning. Dr. Sarah, as a pediatric consultant and a human rights activist, let's talk about the most vulnerable, the children, and what's happening to them, and what you're seeing and what can be done to protect them better in this very dire situation.
Thank you. Very important aspect. What's happening to children and young people is invisible. It's not being talked. People don't talk about it. Although Sudan, we know it's a young population. Almost half of the population are under the age of 21. The risk that the children and young people are facing is beyond, I think, this forum. But let us summarize it very quickly. If I look at health, children have been denied access. We know that there are very limited access to health. So those who are oncology patients, a diabetic patient, those who have TB, finding the medication, finding the follow-up is, a big issue. This has increased mortality and morbidity. The follow-up for children with malnutrition, supporting them in preventive medicine, vaccination, outbreak of measles, and all that you can name it, with diarrheal diseases and the lack of safe water supply. But babies have been born on the move. Pregnant women have been delivering babies while they are fleeing the war. They can't access safe labor, and you can imagine the outcome. Already, Sudan is one of the worst high mortality for neonatal mortality and maternal mortality. And then when we move to issues regarding protection, sadly, the stories about young girls being raped, pregnant, and being exploited in different ways and different means. Boys have been forced to be, soldiers. All of these sort of exploitation and child protection. Children have been separated from their parents. They went missing. Every day when you look, I'm sure, Ahmed, in Twitter or anywhere, there is a photo of a child that is lost. They can't find the family. We are all here, a traumatic nation, but imagine these children have been as well isolated from their parents. The visa and immigration for entering some of our neighboring countries have isolated children from their parents, and we would like to advocate for family reunion. And least, but my colleagues talked about education, about safe spaces. If people are considering funds, it is important. My colleague Fadwa mentioned that it may not be recognized or accredited, but it is a need for the child development, for psychological support, for healing, to have a degree of education, a safe place to play within all of what is going on. People might think this is not a priority, but it is a priority because these children
100%.
will carry this damage all along. Thank you.
No, Thank you, Dr. Sara. That's I think an invisible issue within an invisible war. So thanks for shedding light on that. Going back to Dr. Pauline, I know that your organization has been involved in getting people out of Sudan, especially victims of sexual violence. Can just shed the lights in a minute or two about that.
Yeah, thank you so much. Yes, we've been involved in rescuing, that is, wherever a conflict, if it is in Jazeera or wherever it happens, to try and get them out. I was talking to one of the Sudanese, and she was telling me that the best time to get out of Sudan is after an area has been attacked. The next day you get out. So I am talking of a family which we rescued from Sudan. And it was a journey which you cannot imagine. Walking, there is no bus, there are women, scared, they might be raped on their way. Then we kept communicating. Sometimes you can't communicate because they don't have internet, they don't have power, and they only had their rucksack. That is the clothes they were wearing and a small bag, no food, nothing. So they went staying with families. With Sudanese people are very welcoming because they were taking in all those people who are on the move. They could sleep one night, they sleep here, then they go on the move until they got to the border with Ethiopia. And that is where I may say some of the problems started, because you can't just get into Ethiopia without a visa. And these are people who are running away. So we ignore all the conventions of people who are supposed to be protected. Then they had to, to go across that border. We had to get almost the whole of, human rights organizations to try to go there and get these people out of Sudan. We eventually managed to get them out of there. And for about maybe even a week or more, they could not sleep. That trauma which they felt, it is waking up all the time. They are thinking about what has happened. And for them even to stay in the country, we still had to renew their visa, and the visas went up. And those are the problems I'm seeing, that, you come to the border, you get to the border, you can't enter because you are a refugee, you are running away from your country. Instead of being protected, you are being violated. When you go to the camp, instead of being supported, you militias also, rain on you. They rape you and all that. It is really serious situation. And rescuing people from Sudan, it really takes a whole civil societies on the ground. We are working with them because those are the ones who know the terrain much better. So we were able to rescue them, but I was asking myself, how many more are going through this and they are not able, to come out the way these ones are. So the situation is really dire, and we have a traumatized population.
Understood. No, that resonates. I mean, my own brother, when he came out of Sudan, couldn't sleep for weeks. So and he didn't go through all of the horrors you described. Fedwa, maybe for those who aren't lucky to escape, those who you're trying to help inside Sudan, the idea of the central kitchen was applauded. What are the challenges you're facing there? Why you're not able to scale it more and reach more people with it? What are the challenges you're facing with that idea?
As I have mentioned, that one of the major challenges is the telecommunication issue, that people in these areas, they become out of coverage for like a month. Now we have one of our kitchens running in El Fasher. We have no idea about them for like the last 3 weeks. We don't know if they're even alive or not. So, and we have transferred the money already. Sometimes the money itself is a source of risk for their lives. And those kitchens are done by the volunteers, by the community leaders and the people themselves. So it's challenging because even for the process of running the supplies and the procurement, and there is other issues, that there are some standards for the organizations that we are partner with, like WFP, UNDP, and other organizations. We are so grateful for their support, but they have their requirements, which we really understand that they have their standards, and we need to be up to the standards. But the context in Sudan is really very different now, and it seems like it's even different from what happened in Gaza and Lebanon and whatever there. So we need to be treated as different as we are actually. So this is another challenge, and we keep digging on this, that we need to be treated differently because of the context of Sudan.
100%.
The banking system is really another challenge. We have only one banking application that it's working now in Sudan, and we are running this through and those are just social initiatives and others. So we are dealing through personal accounts, which is not up to the standards, but this is what's available. This is what all available for now.
Start of the possible, I suppose, at this point. I'll come back to you on that, but let me jump to Dr. Mohammed, because I know in our earlier discussion you talked about how you take pride in perfecting this localized aid model, and I think it'll be very interesting to hear a little more about it. So please just spend a minute or two on that.
Thank you, Ahmed, for this again, and yeah, as I've said, that especially with our position outside Sudan, we lack, maybe we hear about Sudan as in the news. You know, all of us, we're not there. We're not feeling the you know, the challenge, the real challenges those people in Sudan are feeling currently. So it's hard for us to imagine what are they being through, and this is why we think that that using those people in you know, aiding themselves, not only just providing just the aid, but also make them as stakeholders and as part of the decision making. This empowering those local people is really what they need, especially. I'll tap to our culture in Sudan. You know, Sudanese people don't like, you know, to just be aided, and we've been facing, you know, for example, just an example, challenges for making, you know, filming stories in the IDP camps, for example, or maybe having interviews with those people in the IDP camps, because they refuse, because they you know, they're not admitting that they're in need. And this is why we think that using even those IDPs and using the community-based organization, make them feel that they are part of the, you know, part of the solution, not that they are just the problem. And this is one of the things that I think we need to concentrate or focus in funding those organizations. It also helped with most of the challenges, maybe Fadwa that mentioned recently, that collaborating with those organizations can overcome most of the challenges.
No, that's I think is going to be very critical as we try to replicate this model and get others to deliver aid in the most efficient ways. Going back to Ronald, I was going to ask you, just given your work, to talk about the healthcare infrastructure, but since you're on the ground, I want to first ask you about, you know, is there a specific personal encounter that stayed with you from all of these hundreds, if not thousands, of cases that you've seen that you care to share?
Sure. I think what hits me the hardest is when you go into a stabilization center and you see a young child under 1 year old who's dying of hunger. And when I think about those children that I saw in my most recent field visit, that is really what motivates me to do as much as I can while I'm in Port Sudan and visiting across Sudan, to reach out to all these children who are on the verge of death because of this situation. And like I said earlier, it's not getting any better right now, and we need to focus on those areas and help those children. That's the one that hits me the most.
No, fair enough. Fair enough. And maybe turning back to Dr. Sarah, one of the questions from the participants, Fadi's asking, what should be the priorities given the famine and the mass displacement in your view?
This is a very important question because obviously the opportunity, there are a lot of needs, definitely. And the way we looked at it from the Sudan Crisis Coordination Unit, we looked into Sudan in different zones. So you cannot look at Sudan just like either just Al Khartoum or just Darfur or just the Jazeera. And the situation is dynamic. So the first part is to divide Sudan according to security and access. So we had 4 zones. Red zone, Khartoum at that time, and Darfur. Amber zone were the internally displaced. Yellow zone, which was the restricted borders, and blue zone, the refugees. The second part, you need to have the information and look at each zone, what is their priority. One priority may be food and water, but for other, may be health services and medication. And that is working with the local organization of what now, like Fadwa and other colleagues have said, they are on the ground. I will be directed by them. We are there to support them, but I don't think we can make decision on their behalf.
100%, 100%. Pauline, I want to return to something you addressed in your remarks about why is this a forgotten war, which I think is the elephant in the room, and I think you mentioned geopolitics, and some argue it's the color of our skin. I'm just curious. I'd love for you to talk a little more. Why is such a mass crisis with all these horrors that we're hearing about just not on anyone's radar?
Yeah, thank you so much. That's not an easy question because I've always been asking myself, why is everybody quiet? Yes, I mentioned about geopolitics, which is actually one of the reasons, because if you're benefiting from a war, why would you want that war to end? So you continuously want to keep fueling the war. And of course, at one time I asked myself, what is it in Sudan that is fueling this war? And I started researching, and of course there are some minerals there. So is that what countries want to control, or what exactly it is? Then the other thing about the color, I go to Darfur and some of the regions, as Dr. Sarah was talking about, we need to separate each area because each area is different. And to understand even this conflict in Sudan, as you said, we have to really go deeper than what we are doing to understand where the genesis of this war. Yes, to some extent is the color. I would say that, well, it really doesn't matter, And also asking myself, also coming from Africa, we are in Africa. Why are we also quiet? Mm-hmm. Why are we quiet when this is happening to our neighbors? That is one question I've been asking myself.
That's a fair question. No, and I think a lot of the Sudanese who are traumatized by this are feeling that letdown towards the Africans, the Arabs, the entire world, and I think the answer remains elusive to a lot of us. Shifting gears, Fadwa, I want you to address one of the questions from Naila, who's asking if organizations like yours have found ways to collaborate with each other, or do we have the typical situation of multiple aid organizations trying to do the same thing and working in silos without coordinating?
Actually, for our organization, it has been our way. It's part of our strategy that we do some orchestration with the local initiatives and the other national organizations. So now there are many national organizations that we're working on, and we have been supported and by international organizations. So this is quite important and very important now. One organization by itself, one man show will not work at all. For each kitchen, sometimes there are more than 2 and 3 organizations working in the same kitchen. And the problem that the cost is very high, the situation is very dynamic, and the challenges are changing every time. And then the safe area today is not safe tomorrow, and the cost of the food materials are changing every day, and even the number of beneficiaries. We have one kitchen in Khartoum that have started last week with 1,500 beneficiaries. Today, the update today is 3,000. So we will need another partner. So it's changing all the time. So we need to work together. No other options.
100%. I think the need is so huge that I don't think anyone can afford to work in isolation. So thank you for that. Dr. Mohammed, just there's a question also from Huwaid asking if there is any geographic variation in the challenge between RSF and army areas. Is it easier to work in one over the other? I think I know the answer, but that was one of the questions that we got. Yeah. I think you're on mute, Dr. Mohammed. So maybe we lost your connection. I'll throw this question to you, Ronald, then, and then I'll come back to Mohammed.
Yeah, sure. I'm not going to compare the two, but what I can say is that we navigate in all the different areas, whichever group is controlling. Because we need to get to the most vulnerable. So we're going to try to keep our operating principles, our ethical standards, but we will cooperate and coordinate with the people on the ground. I've worked in lots of different countries where one different armed group was controlling a different area. You have to deal with what's on the ground, and I think that's what we're doing. We're not involved in politics in any way. We're just here to assist in the most vulnerable. So it's a ballet, so to speak, in negotiation. We want to negotiate access to these areas, and you have to deal with those who are there. Sometimes the people on the other side are not happy that we're in some way trying to recognize these people, but that's not what we're doing. We're just trying to negotiate access to get to the most needy and do our job. Back to you.
Fair enough. And I think the importance of the job you're doing is a good way to end this and to highlight the perils and the risks that you're all taking to deliver this work. So chapeau to all of you, and thank you for being with us today. I'll hand it back to Nihal to wrap it up, because I know some of our esteemed panelists are about to leave us as well. So
yeah. Thank you so much, Ahmed, for this wonderful job today you have done. I wanted to actually ask you a question and sort of tell me, it seems your brother was in Sudan. You've had extensive sort of experience with the politics of it. What is your opinion about why this is the forgotten war? And let me just sort of preface this by saying, on October 25th, I'm sure everybody here knows, but I don't know if the rest of the world knows. 130 women jumped in, committed mass suicide. That is an incredible event that should be on every single person's mind, and every single network, every single news outlet. In addition, of course, to the countless sexual violence, displacement. It's just the scale is so enormous. What, in your opinion, is the reason for why this is the forgotten war?
Look, I mean, I think Dr. Pauline alluded to this. I think part of it is geopolitics and what people are focused on, and who owns the regional media and what have you. But I think, and without delving into anthropology and sociology of how people view the continent, it is hard not to think of people from the outside. It's Africans killing each other again. There's nothing new about that, and it is, let's call it what it is. It's ultimately a racist view of of suffering that happens to the brown man, and it is sad that it even happens from within our neighbors, Arab countries, and what I can't really explain, and that's why I don't think it can be a linear model, is that it's even forgotten within Africa, where we share this kid. So I think it would be overly simplistic to just call it's just racism. I think there's a lot of play, including the geopolitics, including the messiness of the situation. I think in Gaza, it's kind of clear that there's a genocide, someone is being killed. In Sudan, there's blood on everyone's hand, and obviously it's not equal, and I think people are not capturing the nuance of what's happening beyond the headlines, two generals warring, without understanding the exact situation. So I think that complexity might be another layer to it, but it's hard to discount just good old racism in it.
Right. Thank you, Ahmed, and thank you so much for your presence here today. We really appreciate your time. I also want to thank, obviously, all our wonderful panelists. Thank you. I want to thank our attendees. Thank you so much for being with us today and for listening to this important conversation. And I will obviously follow up with an email with all the donation links that are in the chat now, if you want to refer back to those. And lastly, I just ask everyone to please pray for lasting peace for Sudan and for stability, and for the beautiful people of Sudan to overcome this very, very difficult time. So thank
you.
Thanks.
Thank you.
Thank you all.
Thank you.
Thank you. Thanks, everyone.